back pain and discomfort, and you may be one of them. And if so, the issue could be related to your spine. Joining us now to talk more about this is Dr. Patrick Tomak, a neurosurgeon with Hartford Healthcare's Ayer Neuroscience Institute in Meriden and North Haven. Doctor, welcome.
Thank you for having me on today.
Thanks for being here. So pain can be misleading for some people, not knowing what's causing it. What are some of the symptoms with the issues with the spine?
I think with back problems, typically people think about back pain, but they don't think about their legs. So for a spine surgeon, we're concerned when people start developing numbness in their legs, cramping, symptoms extending into their feet, and even weakness. Those are more signs of nerve root compression that typically need to be seen by a specialist so we can guide their care.
All right, what are a couple of the most common spine problems that people are diagnosed with?
Those would probably have to be lumbar disc herniations and lumbar stenosis. I think our young population herniates discs in their backs, and they'll develop not only back pain, but burning leg pain. Most of it we can treat conservatively. Our older patients will develop lumbar stenosis, which is an arthritis of the back, and they start developing, again, back and leg pain and cramping and difficulty when they walk.
Oh, man, it really impacts every part of your life, too. All right, how do you treat spine issues?
We try to start simply, conservatively, with things like anti-inflammatories, sometimes the use of steroids, and physical therapy. I think when things aren't working out and symptoms persist, we look to things more invasive like epidural injections, and finally surgery. And we try to reserve surgery as a last resort for patients who just have failed conservative measures.
What about the procedures? Are you able to do some minimally invasive?
Of course, yes. I think minimally invasive surgery is not for everyone, but more and more we're moving to minimally invasive procedures where we're doing cases through small tubes. You know, for example, I'll do a lumbar disc herniation excision through a small 15-millimeter tube with a little 20-millimeter incision. People go home an hour or two later. Even our fusions now are minimally invasive. We're doing those through a little 20-millimeter tube, so less than an inch, and oftentimes going home the next day.
Wow, that's really amazing. All right, you have a virtual class coming up that's open to the public. Tell us about it and when it is.
Well, it's this evening at 5:30. It's being presented by myself and Dr. John Viner. He's one of my orthopedic colleagues. We're going to talk about common spinal disorders, some of the symptoms people face, and treatment options. So it's free to the public. You can sign up on the Hartford Healthcare website.
Easy, virtual, right from home. All right, Dr. Patrick Tomak, thank you so much for joining us.
Thank you again for having me. Appreciate it.